Right, we turn now to 111. I'm going to ask Barbara to introduce her paper on assuring operational delivery for 111.
Thank you, Chairman. It's interesting that many of the papers we've had this morning have been introduced by the sort of watershed moment of April the 1st, and that's certainly the same for the real change to the way that services for patients are commissioned. And April the 1st was certainly a watershed change for CCGs, who on that date took on the operational oversight of a huge range of services which they commission, similarly the board. And one of those services that CCGs commissioned and they took over on April the 1st was that of the NHS 111 service. And of course at that point we take on our role as oversight of CCGs in supporting them in commissioning the best services for their patients. So the paper is designed to give the board an update on where we are with 111 and seek the board's approval for the way forward. It would only be appropriate for me to start this discussion acknowledging the problems that we've had with performance and some providers who have not been able to meet the key standards that commissioners set for them and not been able to answer the phone to patients quickly enough and respond quickly enough. That has been undeniably unacceptable in many places. Well, not in many places, sorry, I'll rephrase that. That's been unacceptable in some places. But I do think that in all of that, it's really important that we remember that in most places, 111 has provided a very good service to patients for virtually all of the time, and that 111 has made a real difference to patients who have had difficulties and needed someone to help them navigate the system and needed to help them to receive medical and clinical health and advice. The service was designed to prevent the confusion that I think a lot of patients had as to who they turned to, most commonly outside normal working hours when their GP surgery isn't open, and when the patients didn't think that dialing 999 was appropriate because they felt that the condition that they had wasn't that urgent, and there were a plethora of numbers that they could ring and people that they could turn to. 111 is designed to replace all that with a single, simple, you can dial 111 and you can get the advice you need. And as I say, for the most part, people are receiving good and prompt advice. So there are lots of stories we hear about where 111 has made a real difference. My own daughter, who has a new baby a couple of weeks ago, dialed 111 when the baby wasn't well. Fortunately, it wasn't anything very serious, and she received a fantastic service. The phone was answered quickly. She was given the right advice because baby was fine. She was booked into a local out-of-hours clinic quickly and swiftly. We hear of patients who decided they would ring 111 when they might not have done anything else. They might not have bothered to seek medical advice because they had what they thought was indigestion, and it transpired that actually this patient was having a heart attack and an ambulance could be dispatched immediately, and that made a huge difference to that patient. And I think the most compelling story for me is something that happened near to us in Yorkshire, in Huddersfield, where and the parents chose to go public on this, where parents of a child were concerned that the child wasn't very well, but weren't desperately anxious at that time. They rang 111, and the call handler on 111 was able, through talking to the patients, to recognise that the child was potentially very seriously ill. Dispatched an ambulance immediately. The child, who is now well, I'm very pleased to say, did turn out to have a very serious illness. They had meningitis, and the hospital doctors said that the swift and prompt action of getting that patient to the hospital was what made all the difference. So what we must do, we must get this service right, but we mustn't underestimate the advantages to this service, because unlike its predecessors, it is able to dispatch ambulance, make appointments for patients and put them immediately in contact with the medical care that they require. However, as I said, some of our providers let us down very badly. The standards that we look for patients are gold standard. The standards, we measure our standards on two main indicators: how quickly are the phone calls answered, and the number of patients that abandon the phone call and put the phone down. The standards in the contracts that the CCGs have negotiated are gold standard. They're higher than standards that we've expected in previous similar services, and as I say, for the most part across the whole country, which is covered by 111, during the week those gold standards are being met by pretty much all providers. At weekends, over the weekends, we've had some significant problems with some providers really having very, very poor response times, patients waiting completely unacceptable lengths of time, and too many patients abandoning those calls. Now, over the last few weeks, NHS England has worked with the CCGs to work with providers to make sure that the service is safe and the best it can be, and we have seen a very significant improvement from 3 or 4 weekends ago, the Easter weekend, where the standards in a number of places were very poor, through to last weekend, whereby for 90% of the country that's covered by 111, then the gold standards were being met even at the weekend. That doesn't mean we're complacent. We've got another bank holiday coming up. We've put a lot in place to achieve those improvements. As I say, we've worked with providers who have taken on more call handlers. We've put in place contingency, backup, whereby other organisations or other groups who could handle these calls, including the original out of hours and 0845 number, could be switched back on to just manage the risk, and we will be doing the same over the bank holiday weekend to make sure our patients get a great service. 90% of the country is covered by 111. We only have 10% of the country, slightly over 10% of the country, where we need to continue to roll out 111. And again, we've put in place a process whereby there will be no further rollout of 111 in any area until, working with our CCGs and nationally across the country, we in NHS England are satisfied that that rollout can be delivered safely. And also we're working with our CCGs in order to take actions with providers where the service has been unsatisfactory. And NHS England will not shy away from working with our CCGs to support them to invoke the financial penalties where services haven't been at the standard for patients, or indeed to revoke the contracts where we believe that a provider cannot show that they are going to be able to improve on the current standards and make sure they deliver the sorts of services our patients want. So that's the position as we are currently with performance on 111. I think that we now have to move forward and make sure that we've got a fantastic and sustainable service over the coming months and years. There are a couple of things that we're doing in order to make sure that is the case. We will be wanting to look at precisely the nature of 111 in the future, how it's commissioned, the balance between national and local, the scope of 111. Have we got the scope right? Is the potential for 111 to do more as a direct service to patients? The clinical input, are we absolutely certain that the balance between lay call handling and clinical input is right in all the call centres? The shape of provision, we have 46 sites at the moment with a number of different providers. Are we confident that that shape of provision is appropriate? So we will, over the next months, bring regular reports to the board. We've got a programme oversight group, including our CCGs, which will look at all those aspects. In addition, the board asked last time that we put in place, and Bill McCarthy will be leading on that we put in place a review to identify what lessons can we learn from this, what lessons can be learned by some of the actions, mainly of the predecessor organisations, in terms of the commissioning of this service. We need to ask how it was possible, I think, that contracts were awarded to providers who so patently on day one when the service went live couldn't deliver the service that had been commissioned. And again, the lessons learned from the national coordination versus local sensitivity, both of which are important. So that review will look at all of those things.
And that will be a review conducted by an external reviewer. Would you like to add anything to that?
No, I think Barbara's covered it very well. We're committed to learning, so we need to learn how best to do the most complex, large projects. Now, an awful lot of this we took the baton on at a fairly late stage, but there will be times in future where similarly complex challenges we'll be taking forward, so we should use this opportunity to get ourselves into a really smart shape to do those. I have been talking to an independent external person, but I haven't got that name for you today, I'm afraid.
Thank you for that. Moira?
Thanks, Malcolm. I just wanted to ask Barbara, really, who was obviously the public have had a picture of a bad service, even if they've not experienced it directly. What they've read in the newspapers or heard about it is probably giving them a very negative impression. Who is responsible for the kind of information flow to the public about using, when to use it, how to use it, etc. Is that us or individual CCGs? And is there a thought, whoever it is, of doing something that helps people understand, again, hopefully to take them on to, not dissuading people from using it, for example, when it's appropriate for them?
Okay, thank you. I think we both have a responsibility. I think the CCGs have a responsibility to communicate with their patients locally, but I think NHS has an important role in the national message in helping and supporting patients. First and foremost, we have to ensure this service is gold standard everywhere, because I think then that speaks for itself. That is how patients' confidence and the public's confidence will grow. But I do think we have an important role, firstly, in reassuring the public nationally that this is a really very good service for the most part, which does save lives. I think we also have an important role in being clear to patients what they should do, because I think that a lot of this has created some confusion for patients. Who should I ring and when? And the message is simple. At the moment, in areas where we have 111 working, as I say, which is almost 90% of the country, as a safety net, we still have the 0845 number and the GP out of hours number that they're switched through to 111. So at the moment, if you are in that 90% of the country where 111 is working, it doesn't matter which of those numbers you ring, you will get through to a call handler in 111. For the 10% of patients who still aren't covered, if they were to ring 111, they'll receive an answer phone machine saying 111 isn't operational yet and giving them the numbers to ring. Obviously, if they use 0845 or their GP out of hours, then that for the moment continues the same. Our ambition continues to be that over the next few months we have 111 nationally available.
Margaret?
Bob, thank you for the explanation of the oversight programme, which I think is going to be absolutely critical to making sure that the providers who have not met the standard actually begin to improve and that we gain assurance on the improvement. It was also really helpful to hear that there are sanctions available to you. Will you actually publish the sanctions, or somehow inform us of what happens if there has been the ultimate failure of a provider?
Yes, I certainly will report that to the board. The contracts with providers are with CCGs, and those contracts are available, and an understanding of the penalties in those. And I know that in certain areas, those financial penalties have been significantly brought into play. The problem with that, of course, is that it doesn't help our patients get the better service, which is what we need. And we will constantly, I think, in terms of looking at providers, have to measure the balance between continuing to support a provider in order that they can deliver a better service, but at the same time looking at an alternative and being sure that an alternative would be an improvement. But I'm happy to report to the board with the very small number of providers, a couple of providers who've had some seriously poor performance, how discussions with them and their CCGs, supported by us, are going, and the outcomes.
Victor.
Just two questions really. One is, are we measuring public perception and the impact of the disproportionate, and it is disproportionate view that the public are getting a bad service on the usage of 111? Are we measuring that going forward? Because public perception may well affect usage. And are we also measuring the use of 111 going forward by demographic? So are some areas using it more than others, some people using it more than others? Because that will tell us, in a sense, quite a lot about whether it's having an impact on, well, improving healthcare.
We are monitoring those things, and we're certainly monitoring the numbers using 111. We haven't got the ability to have the up-to-date figures at the moment, but anecdotally, the use of 111 is rising because, of course, one of the ways that 111 was introduced, it was a soft launch, so that actually where the 0845 and the out-of-hours calls were switched over until the service settled in, and then we could locally the CCGs could advertise this service to their patients. Of course, the recent media interest in this means that many more patients are aware of 111. It's had a very high profile. We will be doing everything we can to get the message across that, for the most part, patients get a really good service from 111, and give patients the confidence, and which is what it's absolutely vital that our patients have confidence in the service, and for the most part they should have that confidence. And I would hope we can perhaps rely on media colleagues to help us with that message. About the areas where the service is working really well, because there are parts of the country where this service has been exemplary throughout.
Right, well, thank you very much for that report, Barbara. This is an absolutely critical service, and I think for all the reasons that Barbara's outlined, that there is the potential here for 111 to be quite transformational in the way in which NHS improves its responsiveness to patients. Tim, it would be useful, wouldn't it, to be able to understand how we could reflect on the dashboard the level of demand on 111. It's another important indicator of public engagement. I'm going to ask the board if you would please endorse the operational delivery plan, the setting up of the external review, which I think is critical for the reasons that Bill mentioned, not just to learn lessons of what went well and what didn't go so well with 111, but how we would go about such a major project in the future when it arises for us to do that. And then finally also to endorse the longer term strategy for the development of 111. Are we content to do that? Yeah. We are. Thank you very much.